Welcome, everyone. I would first like to introduce myself and the topic of our discussion today. The topic of our discussion will be chronic pain management and natural medicine. As a way of introduction, I'm Eldon Dahl, the founder and formulator of Life Choice. This April will be our 30th anniversary in the natural health industry. In the beginning, after graduating as a naturopathic doctor in 1988, I formulated compounds for my patients' individual needs since nothing was legally available in Canada. At that time, as time moves on, and the formulations that had the greatest impact with my patients are the ones that we formulated and are known as Life Choice products today. Because we'll be talking about several things and we'll be discussing them over and above what our medicinal claims are and our licensed products, I will read a health disclaimer that the information that will be discussed is not intended nor meant to substitute for medical advice from your doctor or other healthcare practitioner, and not intended for diagnosing or treating health problems or disease conditions or prescribing any medication. It is strictly intended for informational purposes only. The topic is chronic pain management with natural medicine. The products that we will be discussing this afternoon will be DMSO, pharmaceutical grade version, sweet relief cream, which is a component of MSM, capsicum, and eucalyptus, DL-phenylalanine, the amino acid, the nutrient SAM-E, and Optical Mag with K2. Normally when I do a lecture in person, I would ask how many know someone in chronic pain. And I think most discussions, the hands go up because everybody knows someone in chronic pain. Just to give you and understand really the emphasis of our training and the impact that pain has on society, we produce this chart to give you a visual impression of this. In Canada, 1 in 5, that's 20% of our population, is in chronic pain. In the United States, it works to 1 in 3. 1 in 3, so that's over 100 million people in the United States are in chronic pain. In seniors living in community, this is living outside of care homes, 60%. That's higher than half of the population of seniors are living with chronic pain. And those in care homes, it's 80% are living with chronic pain. That's 8 out of every 10 persons. Now, chronic pain is not exempted only on adults. 2% of boys and 6% of girls between 12 and 17 are living with chronic pain. This is in Canada. And costs involved. In Canada, the cost of pain-related issues range from $56 to $60 billion. In the next 20 years, with the aging population, it's expected to hit Canada 1 in 3. In this time period, we will match what America is today. In the United States, it's costing anywhere from $560 to $635 billion, more than diabetes, heart disease, and cancer combined. So the subject today is of utmost importance and affecting a large section of the world's population. There are 2 outcomes for dealing with chronic pain. Despite these statistics, those who go to doctors traditionally face 2 outcomes. They're either dismissed or they are drugged. And now they are more drugged. And the drug of choice is opioid drugs. The population in the United States is 4.6% of the world, yet they consume 80% of the world's opioids. In reality, Opioids are just another word for legal heroin. Here's a product that is simply amazing. Probably one of the most misunderstood or people don't understand the importance of this product. If they did, it would skyrocket in acceptability for dealing with chronic pain. DMSO. Now, DMSO is different than the pharmaceutical grade DMSO that we use. It's completely different than the one that is solvent grade. It's night and day. We'll get into that a little further in our discussion to really show the differences between the two. Our packaging is done so there's no leaching of chemicals, because DMSO is a very, very powerful product. So we put it in glass containers, in glass droppers. The DMSO that we use is pure medicinal grade. So 99.9% dimethyl sulfoxide liquid, and it's 90% and 10% of purified water. We have a gel, and it is 90% DMSO and 10% organic aloe vera. And clinical pharmacology, DMSO is metabolized in man by oxidation to dimethyl sulfone, MSM, and MSM is a metabolite of DMSO. The interaction has a garlic-like taste, so it's breath, and on the skin you'll sense it if you're taking quite a bit. If you're taking it once a day, you will not notice that. You'll taste it on your breath. It's a transporter, and it transports very quickly. If you apply it to your hair, on your body, within 30 seconds you'll taste it in your mouth. This means it passes down through the dermis into the bloodstream and into the tissue, so you can taste it. So it's very, very quick. And some people may experience moderate skin irritation and discomfort on administering DMSO. This becomes less prominent with repeated applications, but the healing effect of DMSO is well worth the 5 to 10 minutes of feeling like pins and needles, because it's opening up the capillaries. It's like an isolated, if you're familiar with having a niacin flush, where that area of your body is open and for more blood flow. Now, the difference between the pharmaceutical grade and the solvent grade, we get asked this several times, because as we're the first licensed company with DMSO in the market today in Canada, and the only one that is using medicinal grade, because of the price is anywhere from 300 to 500% more than solvent grade. Solvent grade can be purchased at veterinarians for anywhere from $8 to $9 a gallon, but it has impurities. And this is the thing with solvent grade, it has impurities. Solvent grade is used in industry, like for veterinarian purposes only, but not intended for human use. And that is why it's not approved in the United States by the FDA. And especially considering many are taking the product internally, and they're using it for several conditions, mainly for treating chronic pain that equals the effectiveness of morphine drugs, and for treating cancer. Solvent grade is typically a worry with persons who are allergic to sulfur drugs and may have problems with solvent grade DMSO because of the impurities. Sulfur is not present as an isolated element in the body, but it is a combination of other elements, and most often complex molecules. And here is where the problem arises with the mixture of these other elements. Most people are not allergic to sulfur-containing amino acids, say like methionine, cysteine, homocysteine, L-taurine, and are not allergic to medicinal grade DMSO, but they may be to solvent grade. The benefits of absorbable sulfur is like many of our health products in the industry today, such as MSM and what we use in our sweet relief cream, as one of the main active ingredients. Glucosamine sulfate, which is the natural polymer of chondroitin. The product SAMe, which we will discuss today. The antioxidant L-glutathione, and acetyl L-cysteine, NAC, and again, pharmaceutical grade DMSO. These are all sulfur donors. Now, solvent grade may have sulfites, and sulfites are sulfiting agents, and they refer to a group of simple chemicals that include sulfur dioxide and sulfite salts. Those sensitive to sulfite drugs may get a possible reaction with these products, and this is my caution for those that are using in human use the solvent grade version of DMSO. DMSO, as I was saying, is very, very powerful. DMSO can actually penetrate deep through the epidermis into the dermis level. It can go down 6 to 7 layers into the bloodstream. So it bypasses the dermal membrane barrier. Now, a barrier is meant for our bodies, like the blood-brain barrier, the intestinal barrier, and then we have a dermal barrier that is usually allows only certain things to enter in the body, but DMSO is able to bypass that. So the concentration is very powerful and accelerated. So no residual accumulation of DMSO has occurred in man or lower animals after they have used DMSO treatment for protracted periods of time. So it's completely safe. It's classified as a class 3 chemical, which is the safest chemical used. And DMSO is used for transporting many of the pharmaceutical drugs like chemotherapy. So a rule of thumb, and it should be noted if you're selling the DMSO, is that the first time applying, it is best to administer 50% concentration of DMSO above the neck and 70% concentration below the shoulders, 2 to 4 times daily for chronic pain. And this is where our MSM cream is very beneficial. Our sweet relief cream is you cut it with the MSM. So much MSM cream with the DMSO gel. Now there's several studies. It's probably one of the most studied products on the planet today, DMSO. So several studies show that DMSO is effective for strains, sprains, pain, and in one study relieved the swelling more rapidly than conventional therapies. That's well known. It has also been recommended for skin conditions such as ulcers, open wounds, skin grafts, bruising. If you put it on you hit an area on your body, you put it on, you will not have a bruise form. Secondly, if you have up to 3rd degree burn, of course these are clinical or medical claims, but it was developed when the person had type 3 burn, so a class 3 burn, and he put his hand directly inside and submerged it into the DMSO. And after, of course, it was painful for the first 5 minutes, but there was no scar tissue, there was no discoloration of the skin, and there was no trace that it was a 3rd degree burn. The medicinal uses of DMSO has generally fallen under 3 functional categories, encompassing tissue and organ preservation. So they use it for cryonics, for preserving organs because it does not damage the tissues like freezing does, and for penetrating enhancing, the active pharmaceutical agent, and primary because it's an anti-inflammatory effects. So pain control, takes down the swelling. Pain is always associated with swelling. There are over 1,200 publications on the merits of DMSO. But of course, a powerful product like this fell out of favor in the United States. And in 1968, the U.S. Drug Administration became more rigid. And since DMSO was non-patentable, no clinical trials were undertaken because there was no way to recover their funds. So as we know in our industry, this is very typical. If there was a cure for any condition that was non-patentable, it doesn't get to the marketplace. And cancer is a very good example of that. This book is really beneficial. I'd recommend anybody that is using the product, selling the product, to get this book. We do sell this book at our cost. The things to know about DMSO. And what we can't say about the product's uses, this book does, how it shows the stage 4 cancer and how to take it and how to do it for several disease conditions. Now, DMSO is very water or heat sensitive, and this is something that I have to keep in mind, even when storing in a health store or in your home. If it's stored below 17 Celsius, it will become frozen, and it will crystallize because it's very temperature sensitive, and it will boil at 179 Celsius, so that it's very reactive like this. So if that occurs, and if you have it hardening up in your store, then just move it away from the cooler or the open doors and put it in a warmer area of the store, and it will be fine for selling. And if it does go into a frozen state, then what it is just to put it into a warm environment, or you can put it in a Ziploc bag and put it in warm water, and it'll come back to its normal consistency, but never microwave it. And of course, because it's such a powerful transporter, whatever you have on your hands, if your hands are dirty or if your skin area where you're going to be applying it is dirty, it'll take those impurities deep down into the tissues. So this is again why I say it's so important to have clean hands, but it's also so important to use medicinal grade DMSO. So DMSO has a strong sulfur and garlic-like odor, and you taste in your mouth. This is quite normal. But for the healing effects, this is nothing to consider. The product that we really recommend, and this is a brother to DMSO because it has MSM, is our Sweet Relief Cream. And it has the capsicum, so it has the heat, the chilies, and it has the eucalyptus, which has the cooling effect. And it has 12% MSM, which I believe is the strongest in the marketplace today. And the MSM we use is the trademark version of Lignosol MSM. So it's a pharmaceutical grade ingredients that are in this product, and the results are amazing. So what we recommend to do is to cut the DMSO for skin sensitivity with Sweet Relief. Usually I recommend 1-to-1 level, 50-50, until your body gets used to it, then work your way up. And that's a good ratio. Sometimes 70-30 is used with the gel, and then you have that extra 10% of the aloe vera, organic aloe vera gel in this. The Sweet Relief Cream is 12% MSM, so as I said, the capsicum is what is where you get the chilies from. They get the heat, and it's used in many topical ointments, and many of the pharmaceutical drugs use this because it relieves the pain of peripheral or surface-like nerve endings. So, and it's very good for this combination of Sweet Relief Cream and DMSO for any diabetic. It's a godsend. It's a godsend. When they put it on, they'll notice results probably within 5 to 10, less than 10 minutes. Their nerve ending pain will be diminished. There's several studies on the use of the ingredients that we have in the Sweet Relief Cream. Eucalyptus oil is best known as an antiseptic and decongestant. MSM is a protein found in hair, muscles, and connective tissue. And we recommend that you use the combination of Sweet Relief Cream and DMSO sparingly at first, so your body gets used to it, and not near mucous membranes because those areas are very sensitive. So wash before and after applying. Topical DMSO combined with Sweet Relief Cream in a 1-to-1 has demonstrated actually superior absorption than when using DMSO alone, because it will keep it in the area of application at a much longer period of time. It stays in those tissues longer. So even if you come 4 to 6 hours later, like if you have a bath or a shower and the heat comes onto the area, you'll get that same effect as when you first applied it. You won't have the pins and needles, but you will have the healing, the warm effect of that area. So extremely good for rheumatic conditions, arthritis, osteoarthritis, rheumatoid arthritis, and for topical, for dermatology. So there is a randomized double-blind placebo-controlled study showed that 50 men and 50 women who had osteoarthritis in their knees, MSM and supplement because of its sulfur bearer, like DMSO, improved both pain and physical function without adverse effect. In another study, patients were taking MSM had over 80% better pain control than those on placebo. And I believe if you were to add to the MSM, the DMSO, you would have had 100% pain control over placebo. So it's an amazing product, the go-to product for chronic pain. Anyone who comes in your store, family members, those that have cartilages that or the cartilage that is like last night we were in a store and we recommended it highly. This fellow that worked in Canadian Tire, he was hobbling. He says DMSO is going to change your life with sweet relief. You do that in 15 minutes, you're going to be totally amazed at the healing effect. And that's how powerful the products can be. This product here, DL-phenylalanine, it's nature's painkiller. And this is one you take internally in capsule form. It is it's a free form. It's fermented, and DLPA is an amino acid, and it's useful for even for when you're anticipating pain to happen. Now, no one anticipates pain, I'm sure of that. But if you have some surgery, or if you know something is coming up when pain will be administered, then you take this 6 to 8 days prior to that. Take 3 grams, so 6 capsules a day for the time period prior to it, and you will not have the pain. I had orthoscopic surgery done on my knee. I did this protocol, and after surgery, I had absolutely no pain when everyone in the room had the same type of surgery, and they were all in pain, all on medication for pain control, and most of them were not able to hold anything in their stomach. They were throwing up in this nature, and I was perfectly fine. So it's a DLPA is as I said, a free-form fermentation amino acid, so very safe. It helps to control the pain, and because the phenylalanine is a mood balancer, it helps with mood balance. So it relieves pain from whiplash, rheumatoid arthritis, lower back pain, migraines, muscle cramps, soreness, post-operative pain. It boosts emotional euphemism for life and fights depression. Effective when increased over time. So here is where when you normally start to take it, it will build up within the tissues where it will take about 6 to 8 days to really build up to its full tolerance level, and then you don't need to take so much, but it has to be actually stored within the body, and the longer you take it, the more powerful it becomes. So it's also good for post-exercise soreness and appetite suppression, and because the phenylalanine part of the DL-phenylalanine are so concentrated on moods, it helps with the focus. So there are several studies. We have several that we wouldn't mind sharing if requested. And one open study said 78 chronic pain patients received 750 to 1,000 milligrams of DLPA. After 1 week, 50% patients improved, had noticeable improvement. And this doctor says that 93% of his patients use a combination of electromagnetic current, proper diet, nutritional supplements with amino acid, DL-phenylalanine, and meditation. And he says that most patients took a minimum of 1,000 milligrams 4 times a day, and they didn't require it for pain after 14 days. Now, I would say if he would have raised the dosage up, they would have had 100% recovery from the pain. It's that powerful of a product. The product that is another sulfur-bearing product These are all in the category of sulfur-bearing products, DMSO, MSM cream, and SAMe. Now, SAMe is actually occurs in every living cell within the body, and it takes part of several biological reactions, yet it is not found in our food. It is made in our bodies from the amino acid methionine. SAMe liquid helps to promote healthy mood balance. It relieves the symptoms and pain of osteoarthritis. It supports the liver function, so those with fatty livers, cirrhosis of the liver. It's incredible for what it does. It's what they actually use for this is if someone had to have a liver transplant, they would put them on the SAMe until a liver donor is made available, because it will function and hold the liver in a workable state that the person can stay alive, because it's that powerful for treating the liver. So it relieves pain and in the same time cleanses the liver. We know that there's all kinds of drugs in the market today that deal with chronic pain, and aspirin, ibuprofen, acetaminophen. In our arthritis strength dosage, those drugs have devastating side effects. Over 100,000 Americans are hospitalized annually from the side effects with drug-induced ulcers, and more than 16,000 die. In a dozen clinical trials with more than 22,000 patients, researchers found that SAMe is effective as pharmaceutical treatment for pain and inflammation without any signs of digestive tract damage, no sexual dysfunction, no dry mouth, or nausea. This is all associated with the pharmaceutical drugs. Also, SAMe also shown no signs of drug interaction and can be taken along with most, if not all, prescription drugs. So that makes it very powerful, especially those that are on multiple medications when under a physician's or doctor's care. In SAMe in 1999, Time, Newsweek, USA Today magazine said SAMe is comparable to state-of-the-art treatments in both depression and arthritis. So it promotes health by contributing to building blocks of cartilage and prevents migraine headaches. SAMe, what to expect? Mood balance is said to be effective, if not more so than prescription drug medication. Pain relief, especially osteo and fibromyalgia. Liver benefits, preserves the liver for those who are on a liver transplant waiting list. The next product I would like to talk about is our Optical Mag complex with K2. And the K2 we use is the Magnesium 7. It's an advanced multi-mineral more than just a calcium magnesium complex. The combination lowers the risk of osteoporosis, provides the optimum balance of calcium, magnesium, and K2. Now the K2 we use is 99% MK7, the highest availability for cellular absorption in the world, the form we bring in on this product. It supports muscle function, activates enzymes for carbohydrate metabolism, and it's an advanced delivery formulation. The ingredients that are in the products are simply amazing. I would challenge you to look at any calcium on the market today and try to find an equal combination like this. So it has the calcium citrate, has the calcium orotate, has the magnesium citrate, magnesium biglycinate, the magnesium orotate. It has the K2MK7, MSM, the paradoxal 5-phosphate form of B6. It has vitamin D, potassium aspartate, and boron citrate. It's a complete multi-mineral, and it's 100% pharmaceutical grade material, and the MSM is the lignosol trademark. It has so many benefits. The typical Western diet strips the body of calcium. And calcium citrate malate has been found to be more bioactive than calcium carbonate. And the form that we use in an orotate form is 8 times more powerful than a carbonate. So magnesium is the most likely macronutrient mineral deficiencies in the human body today. And because a lot of people are taking calcium on its own, it's actually causing more damage than good. Magnesium orotate can be useful for diabetes, hypertension, dementia, migraines, asthma, chronic lung disease, cardiac conditions, and osteoporosis. And these are all found by taking the orotate version of magnesium. Although not as prevalent in the diet as K1, K2, Manacon 7, is vital to regulate calcium within the body, so it can also help with heart disease. So for lessening nerve ending pain, sensitivity, and tooth sensitivity, to eliminate all tooth sensitivity, take 2 capsules at breakfast, 2 at dinner, 4 capsules a day, and within, I would say it wouldn't take 3 weeks, but up to 3 weeks, and you'll see results where tooth sensitivity, no need for Sensodyne toothpaste will be eliminated, and those with nerve ending pain, those will also be eliminated, like diabetic neuropathy and any pain condition like arthritis where their fingers and they can't touch them, their skin is so sensitive, that would be eliminated or drastically reduced. Formulation was designed, and this is the unique nature why it's so powerful. It was designed for cellular delivery via electrolyte carriers. So it's not only you have the nutrients, but the carriers that bind it in a chelating form actually take it intact without dislocating. So it doesn't break apart and go outside of the gut. It actually, without breaking down into its component ions. And when it gets to the receptor site, then it is released only at the cellular level. And the minerals are delivered directly to the cell nucleus without being eliminated by the body prematurely. It's the most advanced form of multimineral calcium on the market today for restoring bone growth. Orotates are derived from orotic acid, nucleic acid. And orotate is a very effective molecule for transporting minerals through cellular membranes. Orotates function as an essential part of every living cell. Optical Mag was designed to promote bone growth by increasing the production of osteocalcin in osteoblasts, which allow the calcium that's within the body to actually build bone. And this formula actually will help scavenge inorganic calcium and reabsorb it back into the bloodstream. So by taking this is actually you're cleaning your body of inorganic minerals and reabsorbing it into an absorbable state. Now, an inorganic form of calcium is what we have as bone spurs. We have plaque on our arterial walls, plaque on our brain, which causes, of course, dementia and this nature, hardening of the arteries. This is all from inorganic calcium, and that's abundant in our typical diet today. In conclusion, pain is too large of an issue to ignore. However, natural alternatives can help if they are of high pharmaceutical quality. Life Choice products are a reliable way to manage chronic pain without any harmful side effects. Now, natural healing is possible to the point of matching or surpassing pharmaceutical drugs. But in order to achieve therapeutic results, the formulation must be produced using the same pharmaceutical grade that the drug companies use. It has to be of that high quality to match those results. And that's what we do with Life Choice products. They are sourced from the highest possible sources within the world. We do not formulate based on how much it will cost that on the shelf. We formulate our formulas based on how therapeutic it will be to the human body. And that's why Life Choice products work time in and time out and are a very effective alternative to drug therapy.